Dundee Institute of Healthcare Simulation has been around for about 30 years. This part is a surgical skills centre and it was set up by Alfred Kusheri, and at that time it was the first surgical skills centre in Europe, really designed for developing laparoscopic training. But since then we've diversified and we have training across a whole range of different specialities, from veterinary medicine to GPs to undergraduate teaching. But we also provide training at different levels, so from a basic level to more advanced masterclasses. We have high level facilities in terms of simulators, so we have a range of basic simulators that you can see behind us to more advanced simulators, but also really using the most high level simulators in terms of human cadavers, and by using them we can mimic what really happens in an operating theatre. And the evidence shows that the more realistic your training scenario is, the better surgeons are trained for operating on real patients. Although our main aim here is a training centre, we do put research as being very important for developing techniques for the future and improving training. So one area of research is looking at how we train surgeons, and that's an area we don't know a lot about. So do we train them longitudinally with lots of different training packages? How much time needs to be with simulators? How much time with more advanced, such as working with cadavers? And at what time should we provide that training? And how do we assess that surgeon is now fully trained to operate on a patient? So that's one line of research we're very active in. We're also involved in research in developing new surgical devices and equipment, so looking at how we optimise particular laparoscopic surgery, but we're also involved in robotic research, so we link up with Heriot Watt, for example, looking at how we improve robotic arms to improve how we deliver surgery for patients using that device. So being able to train surgeons efficiently, effectively and safely is so important. Our surgeons now are training in a much shorter period of time. They have less exposure to operating on patients under supervision, so being able to train them in a simulated environment, to me, is a vital part of surgical training. We can start with very basic simulation, so just tying a knot on a rubber band, but up to doing microscopic surgery on a cadaver, such as we do with ENT surgeons, or developing even new devices, so where we train people to fit pacemakers, for example, or where we're developing new techniques for treating prostatic disease, where we fit a device and then we look at the prostate gland afterwards to see if that's been effective. So it's not just training surgeons, it's developing new devices, new surgical instruments, and training not just surgeons, it's training other healthcare providers. So we might train the whole surgical team and how they communicate, but we might also train different industry partners.
Cutting-edge medical research and technology used to train the next generation of innovators that is taking place in Dundee makes it the perfect location for conference organisers to capitalise on this wealth of knowledge and expertise.